Motivators. This is Dr. Drill, and I'm going to drop a little bit of knowledge on you regarding flexibility training. It's important that you square this away in your daily routine, both before, during, and after exercises, and then also throughout the day. This should be a hygiene, like brushing your nasty friggin' teeth, or wiping your butt, or combing your hair, pruning yourself in many ways, cutting your toenails, all that sort of stuff. You picking up what I'm putting down? That's good for your health. All right, so flexibility is huge. I'm going to talk to you about the importance of being long so that you can be strong. And there's a young lady here on this video clip, just about 30 seconds of it, that's going to share with you the details of muscle flexibility and normal muscle physiology. Stand by.
Each sarcomere consists of alternating thick and thin protein filaments, giving skeletal muscle its striated appearance. The muscle contracts when these filaments slide past each other. The thick filaments are myosin, which are anchored at the center of the sarcomere, called the M line. The thin filaments are composed of the protein actin, which are anchored to the Z lines on the outer edges of the sarcomere. Because the actin filaments are anchored to the Z lines, the sarcomere shortens from both sides when actin filaments slide along the myosin filaments.
So there you are. The sarcomere is the functional unit of the muscle. Okay, so I've also got a Word doc here that I put together to illustrate this further for you. Here's a sliding filament model again. We've got a stretched muscle here, or at least a relaxed muscle. And then to the right, we can see that the muscle is contracted, those actin and myosin filaments that were previously mentioned, sliding past one another. That's how it works. And then down below here, you can see that there is, looks like maybe a scanning electron microscope picture, an image here of the sarcomere. And that's what it actually looks like. So if you can, pair up this animation with the real deal, it's extremely impressive. And again, this right here is what gives the muscle its striated appearance, as in a lean bodybuilder flexing in a most muscular pose. That's what's creating those striations, visible striations in the muscle. It's really, really cool. And of course, we've got the sarcomeres linking up and creating a myofibril and then a bundle of muscle fibers. And then we've got the actual muscle belly of the biceps brachii in this very svelte individual who has closed body language for whatever reason. She must think she's a badass. And, hey, we'll straighten her right out. So here, if you can look at that sliding filament model and you see this image of the clasped fingers, if everybody could do that right now, get it done. You're going to take your fingertips, just barely touch them, and then reach or squeeze your hand into a full clasp. That would be a contraction, and then squeeze for a little extra measure and emphasis, and come back out to the stretch position with your fingertips barely touching. That's my analogy, full active learning exercise for the sliding filament model. And so if you slide your fingertips all the way out there, and then you powerfully contract, you can imagine and illustrate to yourself how important it is to have flexibility so that you can actually conduct a maximal contraction. In fact, with a seated workforce, you've got a lot of people whose neck muscles are partially contracted already, and so they're not really functioning the way that they could because they have chronic postural problems, tight neck muscles that are causing metabolites to be built up within the muscles, and then pain, neck pain, headaches, and then they got to go see Dr. O and put their head on a swivel like a friggin' owl. It'll turn their head around 360 degrees by the time they walk out. But it'd be much easier if they just practice their flexibility training. Last but not least, we have some microscopic views of some of the structures that on a microscopic level help to keep us flexible. We have collagen fibers in the pink and elastin fibers in the purple, and these are like rubber bands, like a tough, flexible rubber band that help various tissues such as the skin, muscles, tendons, and ligaments maintain their elasticity. You got to be long to be strong. Stand by for the next video of myself leading you in a stay from the ground up warm-up flexibility regimen.